A very warm welcome, everyone, to the first episode of Inside Implementation. This is a webinar series that is part of a 5-year project titled Anusthana. The full title of the project is Implementation Research for Scaling Tobacco Control Policies in India. This project is currently being undertaken at Institute of Public Health, Bangalore, and is supported by the Department of Biotechnology and Wellcome Trust India Alliance. So today, on the pretext of the World No Tobacco Day 2020, the topic of our first series is Youth and Tobacco Control Policies. So we are very pleased and privileged to be joined by Dr. Swasti Charan, who is currently working as the Additional Director General of Health Services in the Ministry of Health and Family Welfare, Government of India. And he's currently overseeing the National Tobacco Control Program, National Oral Health Program, as well as the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Strokes, or the NCD program. He has done his MBBS from the Regional Institute of Medical Sciences, Imphal, and his MD from National Institute of Health and Family Welfare in New Delhi. Following this, he also did a master's in public health from the Massey University in New Zealand. So as we can see that he's holding these multiple portfolios, his main interest and thrust is on integrated approach for implementation of various national health programs to ensure that the results are synergistic. We also have with us today Ms. Shering Bhutia, who is the Vice President of the Preventive Health Program at Salam Bombay Foundation. She holds a master's degree in broadcast journalism and a postgraduate in social entrepreneurship management, and also a Johns Hopkins certificate on tobacco control. So her major role over the past 15 years has been to generate evidence and translate these to effective tobacco control policies. She has organized several national and international conferences and consultations and participated and presented at various fora, and also authored papers on smokeless tobacco use, especially in the youth in Mumbai. So along with this, today, the co-moderation of the session will be done by Dr. Prashant Nugehalli Srinivas, who is also a Department of Biotechnology Wellcome Trust Intermediate Fellow. He is a medical doctor by education and has a PhD in public health. His primary interest lies in health equity, in health policy and systems research, and in tribal health. So we are very glad to have this combination of a national level policymaker and a grassroots level implementer, both of us who will be talking about implementation of youth specific tobacco control policies in India from their perspectives. So without further ado, I'd like to thank you all for your time for joining in today. And we'll go ahead with the first presentation by Dr. Swasti Charan. So if you could share your slides.
Yes. Is it visible now?
Yes, sir. It's visible now.
Thank you, Pragati, and thank you for inviting us to this workshop. And since webinar is going to stay here as a normal thing, it is the best way to reach out to all of us discussing many issues. So today we will be discussing about the policy framework for youth-specific tobacco control in India, the opportunities which the COVID-19 times has provided us. In fact, you know, we were already proceeding with our activities in peacetime. So when we have this wartime of the COVID, we were only adapting some of what we were already doing during the peacetime to, you know, get the opportunities rightly harnessed during the COVID-19 times. To just give a brief about tobacco for those of us who are not baptized to tobacco control, we should remember that tobacco is a process from leaves of a plant called Nicotiana tabacum, which goes back to the discovery of Americas, from where Christopher Columbus brought back to the Europe, and from there, with the colonization, it traveled to various parts of the country. Tobacco smoke, the smoking forms contains about 7,000 chemicals. 69 of them are carcinogenic, and the smokeless, or the chewing or the snuffing or sniffing or even the gurgling forms of tobacco, the smokeless tobacco, we call it commonly, they contains about 3,000 chemicals. 28 of them are carcinogenic, but just don't compare the two numbers. They are numbers, but there is no safe limit for any of the chemicals. So it is like jumping from the 19th floor if you smoke. Then if you want to jump from the 13th floor, you are using the smokeless tobacco. The outcome for both is quite obvious. As I said, it's as old as the human civilization, and after it was brought to the Europe by the Americas, again with the Portuguese, it came to India, and there has been widespread acceptability after that. And it is now a cash crop. It is not just driven by the economy, but also by a multitude of cultural and social and even religious factors now. So much so that we have got this plethora of smoking from the smokeless tobacco, and the tobacco industry brings you another novel products in the form of electronic nicotine delivery system, or what is known as the e-cigarettes or the heated tobacco products, another form of novel products for nicotine delivery. Unfortunately for us, the Ns and the HTPs are banned in India. What could be the burden in India? About 26.7 crore were estimated to be the tobacco users by the Global Adult Tobacco Survey, and 19.9 crore were using the smokeless tobacco. About 10 crore were smokers, and 3.2 of them were crores were both using either tobacco and the smokeless tobacco. So among the youths, again, we also have another survey called the Global Youth Tobacco Survey. The recent survey that GYTS that we have conducted is likely to be, we are analyzing the data, but the previous GYTS indicated about 14.6 are the current users. And then when we, just to find out why people are using tobacco, you will understand that 24% of the boys and 13% of the girls think that, those who smoke have got more friends. That is a very alarming finding. And then we asked them, where do you get it? They said 5.7 of them said it's at home, and 47 of them say they buy it from the store, which should not be happening. And then 56.2 of them say that the store did not refuse them. That is there is a very startling finding, that the store should not have given the tobacco products to them as per the law, but they could still get it like that. So these were some of the findings that we have from the GYTS. So why do we discuss tobacco in India or elsewhere in the world? Is that tobacco continues to be the risk factor for the NCDs in our lives. Then there are other factors as well: physical inactivity, unhealthy diet, harmful use of alcohol, and then because of the many causes of mortality in India. If you see that NCD plays a very important role. So the tobacco being a risk factor for the NCDs, we are dealing with tobacco when we try to deal with the causes of mortality in India. So 13 lakh people die because of this. So if you just remember 13 lakh, it is like 3,500 people dying every day in India due to tobacco use. But since they die with cancer, cardiovascular disease, COPD, or tuberculosis, or periodontitis, or sudden infant death syndrome, and so on, we seem to have different patterns of death. But if you all link them to tobacco use, it is about this 3,500, which is about 6 to 7 jumbo jets with 300 passengers, each crashing. All of them crashing on a single day. That is why we were discussing tobacco. And if you want to sum up what is the total impact on health, if you see the figure, you can see the cancers of the oropharynx, larynx, esophagus, trachea, wherever the smoke travels, and it is going through the various parts of the body, and also because of the various chemical interactions which the tobacco smoke contains and has with the body, they also let the person suffer from cancer from various remote part, as remote as cervix as well. Then they, as I said, cause many chronic diseases and other complications of diseases like diabetes, etc. So among the youth, the cigarette smoking will lower the lung function, and also they suffer from all the long-term health consequences. So smoking also reduces the lung growth. So during the COVID time, if you remember this too, if you are a tobacco user, you are going to have a compromised lung, compromised immunity to fight with the pandemic. Okay, so the health effects among the youth, if you sum up, these are the health effects, and then most importantly, the affect the physical fitness, including impotence being caused to the youth. So that's very important among the youth, apart from the other diseases which is caused by tobacco. So those who those of the smoke who smoke, they suffer from 3 times more likely than the non-smokers also to use alcohol. The smoking is a gateway product. If you smoke, after that you want to experiment alcohol. Then if you smoke and use alcohol, again you want to have experiences of marijuana or even cocaine. So these many times the smokers are prone to develop the hard drug. It is a gateway product for many of the hard drugs. And then yes, smoking is associated also with other risky behaviors such as fighting and unprotected sex, etc. So that is why it is all the more important, and why we need to target. This is a race against time between us and the tobacco industry. The tobacco industry also wants to try to capture the youths, because about 13 lakh people die every year. So that is a customer base losing every year by the tobacco industry. Because of that, they also try to trap them young. Now, when they want to trap them young, they have to trap the youths, because if you introduce tobacco or any addictive substance as young as possible, it crosses the blood-brain barrier. If you do it in a very high dose and if you very rapidly, then it the development of the brain, developing brain, gets wired in such a way that you stay addicted throughout their life. So they become the customers of tobacco industry, which finally kills them prematurely. Because of this, they also target the youths by glamorizing the products, and then by saying that if you smoke, you look cool, or even if you tell them that it is associated with adventures and vitality and social success. And then many of the literary festivals and so on, I don't know why, but the poets and many of the literary people that we see around the world, the industry always tries to link them with alcohol and smoking, as if those who are non-smokers, those who are non-alcohol users, are not able to write anything kind of thing. Now, this is the image that the industry has introduced through the various media, like the films and drama, or even the advertisements they put out. So India, it is very important for us, because India has a very young population, that probably many people say that we are a little safer compared to the other European countries. Even during the COVID time, there are some speculations saying that, but even though that may not be proven, or we have no evidences as of now, we know that India consists of lots of young people in India. So because of this, we need to protect them, and we need to protect them from the industry, which is the theme of World No Tobacco Day this year. So how do they do it? They put lots of flavors to the children, so that the harshness of the tobacco, they want to reduce it, and they introduce novel products like the e-cigarettes, and they advertise and place in the movies and the TV shows, and which now comes through various social media platforms like the YouTube or Netflix or even the Amazon Prime, etc. They get into the youth's mind and houses through them. Promotion of tobacco products and free samples are also few of them. So you can see now that how different parts of the world, the tobacco industry could have exposed them to tobacco, and then why we need to introduce them. During the COVID pandemic times, we all know the vulnerability of COVID. Who are vulnerable? Those people with COPD, cancer, etc., and those people who cough are going to sneeze, and the pandemic is new thing. We are into it for the first time, even though we had some experience with the Spanish flu long time back in 1918 and so on. But this has come as a surprise to all of us. So during this time, we knew because of the various tendencies that the smoking tends to cause, or the SLT users who otherwise, increase the salivary excretion to about 300 times, will need to spit out. So if you are a COVID patient and you are a SLT user, you have 300 times the salivary glands, over functioning, and that amount of saliva you can also, you have to spit out all the time. So that can also lead to lots of increasing in this way. And because of this, we need to strongly implement the 5.3 in such a way that we distance ourselves from the tobacco industry, and we look at lots of other activities now. So it is not to be an essential. This was one of the policy, and it preys on your lungs. And then we have got the armamentarium with us, the NTCP, the program, then the Framework Convention on Tobacco Control, then the law that we have here, and the strategy that we follow for the Empower. So this is how we were trying to cope up between the 2019 COVID outbreak here. And then these are some glimpses of the tobacco control program, which raised the increased awareness and the harmful effects of tobacco and the tobacco control laws, and then implement the code part that we have. Then these are some of the components. We need not go into the details of that. And we also help people to quit through various means. These are layout of the different tobacco control cells and the NTCP. Those of you who want to go into it detail, you can look into it in further. And these were some of the highlights about the FCTC which India has signed, and under that obligation India has been working for tobacco control. So we link many sections of the CODPA with the provisions provided there with the Empower strategy in such a way that we also achieve what the national wants to achieve. At the same time, we also try to implement whatever is there in the Empower policy, so that we sync ourselves with the requirements of the article, with the articles of the FCTC. So these are some of those strategies that we do. We monitor, then we protect them, and we also have the helpline number which reports the violations, and we offer them cessation through the quit line, as well as the M cessation that we have, and the tobacco cessation centers, and the NCD clinics providing centers for counseling. And then we warn through the films and the PEC warning, which is about 85%, and the various media that we have. And then we also enforce section 5 of the article with to enforce TAPS ban, and because of the film rules, we also have some free air to provide the information for the against tobacco and for the tobacco control laws as well. Then we also raise tax attracting about 28% of all tobacco products as a demerit goods to make exorbitantly high the tobacco products, so that the affordability of tobacco products remains low. Then these are some of the achievements. We all know that there has been a ban on spitting and the SLT use during the COVID times. I hope even after the COVID, this also continues, because this will help people to quit tobacco, as well as also help us to save ourselves from many of the communicable diseases which causes spread, or which spreads through the spitting. Okay, then many states have followed the advisory and also come up with many advisories on their own. And these are some of the examples of the directive under the COVID-19 management. And we also have the school guidelines for the tobacco-free educational institutes, which we have shared with the states to implement and protect the youths in the schools. And we have, from the ordinance, I forgot to correct this, it's already an act to prohibit electronic cigarettes and the like products like the HTPs in September last year. And we also had lots of conferences and other achievements that under food standards. We have banned Gutkha, and we also employ Section 777 of the Juvenile Justice Act, and then other activities which I have already mentioned earlier. So these are some of the activities which increase our interaction with the other stakeholder departments. And finally, for today's workshop, I need to tell you again that we have got this quit line. I know we must be talking to many of us who are already non-tobacco users or who are already tobacco control people, but we need to popularize our quit line and the MC session number so that as many maximum people we can help them quit tobacco. So these are some of the awareness campaigns that we have run through. That this is how we are trying to integrate for the cessation services throughout India with various partners, including TCCs and dental colleges and NOHP and NCD clinics as well. And that's all I have to share from here. It's very difficult to squeeze tobacco control, which we can talk on and on for 15 minutes, but this is what I wanted to share with you. I think I can answer questions whenever that comes up. Thank you. Over to you, Pragati.
Yeah, thank you. Thank you, Dr. Swasti Charan, for your presentation. I agree, it's really difficult to present her slides, and after that we will be having the Q&A session. So whoever has any questions in the meantime, please feel free to type into the chat box. I request Sharing now to share her slides and start the presentation.
Hello.
Yes, Sharing,
Yeah.
you're audible. If you can just put the slideshow, yes, that would be perfect.
Yeah.
Yes, please go ahead.
Thank you for the introduction, and thank you so much, Dr. Swasti, because I think you have already set the context for what I'm going to present. So I won't mind skipping on certain slides because you have already explained, and I think you have already created a base where everybody who is present right now here and attending this webinar will understand that why Salam Bombay Foundation is working with youth. So I don't think that I need to explain this a slide where, of course, we say that 1 out of 5 individual in India is an adolescent. And definitely, if they are healthy, then it is going to be a demographic dividend for the country. But down the line, if they are not healthy, then it can be a demographic disaster. This I will skip because then, of course, Dr. Sati has explained it, that every 16 seconds, the child in India tries tobacco for the first time. There are cases, of course, which we are witnessing where school children and as young as 10 years or 12 years are having oral submucous fibrosis. And on top of that, as Dr. Sasti has also explained in his slides, the tobacco industries has different marketing tactics where they try to recruit more young kids, adolescents, or youth as a consumer of their product. Because as we know, the current consumer are going to die at certain point of time. And considering all this, Salam Bombay Foundation started its program. So the program, the model that we have is an holistic model. It has a holistic approach to tobacco control. First, we try to reach out to an individual level, to the children, and then, of course, whatever information that Dr. Swasti has given us today is the same information which is passed on to kids. And then we also try to reach out to the community so that we can build the capacity of local leaders to join the tobacco control movement. And finally, we also interact and we do various programs with the policymakers. This is the model of Salam Bombay Foundation. And when we go to the school, as I said, what Dr. Sasti Charan presented is the same awareness content that we also pass on to our kids. It's an entire tobacco control session with the students. It's a 12 sessions. This is how we do. And in addition to the technical knowledge, when I say technical knowledge, it means all the awareness which is required about tobacco, whether it is ill effects of tobacco, from where it has come, its history, how it can affect your health, how it can affect the health of the community, and everything is told to them. In addition to that, they are also introduced to various lawmakers, policies which we already have, different kind of departments who can be involved for tobacco control. But having said that, these children, especially the children that we work with, come from underprivileged background, and their life skills also needs to be honed. And this is where we try to improve their life skills, whether it is their self-confidence, whether it is their refusal skills, whether it is their peer pressure. We try to address all those issues. And then we also know the children that we work with come from such kind of a background where there is nobody to help them, nobody to guide them. And we have also noticed that they are very talented and too much of energy, but that energy has not been streamlined. And this is where we have various kind of academies like sports, arts, and media, where we try to streamline their energy into, rather than putting their energy into experimenting with tobacco products or other addictive substances. We also have a tobacco cessation program. We call it Life First. It has two parts. One is for the workplaces, another one is for the children. And it has really been very, very helpful for us. We also have a tabloid, which is called Halla Bol. And this tabloid is, of course, the articles are being written by children. It is being edited by children, and then it is read by children only. So far we have around 282 students who work for this tabloid. And then every month we release around 5,000 copies, which is being distributed among children in municipal schools in Mumbai. We also have a tobacco-free school app. So we promote tobacco-free school policy. As Dr. Swasti explained and also showed in his slide, that there is a guideline for tobacco-free school. It is the same guideline that we have been following since years. In fact, before then, when ministry made it very formal, it was a CBSE guideline, and from there on we have been following this and trying to implement in the schools. But how to monitor it, and that therefore we developed this app, which is called Tobacco Free School app, which is on a mobile. Every teacher has to download it, and the status of 11 criteria under tobacco free school has to be updated on this app. So far, around 22,571 schools have registered in this app, and around 9,774 schools have attained the tobacco-free school status. We give them this school status when they completely or they fulfill all the 11 criteria. There are schools who are trying to attain tobacco-free status, but they have not completed all the 11 criteria, and therefore they are not mentioned over here. As I said, we have also a Life First program, which is a school-based cessation program. Now here, the children are recruited, and it is not forced on them, it is voluntary. So whosoever student wants to enroll themselves in this program can enroll with us. It's a one-year program, and the counseling is also done in two ways, as per the convenience of the child. If he is convenient, then it can be done in a group way also. If the child is not convenient in doing so, then we do an individual basis counseling session too. We do not here believe on the medical or the medicines, and therefore everything is done on the counseling basis. Now, moving ahead, as I spoke about honing their life skills, and therefore we have certain students whom we call change agents, and they are termed as Bal Panchayat leaders. So in every school, in every class, there are 8 Bal Panchayat leaders, and there is an election process where the students are being elected by their own classmates, their own peers. And these students who are called Bal Panchayats make sure that in their school, the tobacco-free school policy is followed. They try to make their school tobacco-free. They also create awareness not only among their peers and friends, but also among their teachers, school staff, and going back in their community too. At the same time, they also, because then they are empowered now, we have equipped them with all the tools that they need for tobacco control. They are also introduced to various entities which can help in tobacco control, and therefore these are the students who go ahead as a change agent and have been very helpful to us. They have been creating awareness on COTPA, on tobacco, to various stakeholders. Now here in the pictures, as you can see, Mumbai itself, I'm not talking even about Maharashtra, I'm only talking about Mumbai. Mumbai itself has 94 police stations, and in each police station, our Bal Panchayat students go and then create awareness among those policemen about the ill effects of tobacco, and as well as they make them aware of the tobacco control law, which is COTPA. You can also see that our children are going and sensitizing the best staff. The best is, I think, is the biggest fleet, bus fleet, has the biggest bus fleet, and they have a lot of conductors and bus drivers. Our students go and then sensitize them also and create awareness among them. You can see the students who are our Bal Panchayat leaders have gone and met the ex-chief minister. They were talking to him about the ineffective implementation of Section 5 of COTPA, because they had done a study where they have found around their school that there are a number of shops which are violating Section 5, and they went to the chief minister advocating for a strict and a stringent action to be taken against those shopkeepers for violation. Same time, you can also see that they had gone and then meet the then police commissioner to take violation against tobacco shops violating laws. There are a lot of other activities also which the students do from time to time. They also capitalize on the festivals, public festivals, which come from year on to year on. For example, Ganpati. So Ganpati, Ganesh Chaturthi is a big festival in Maharashtra. We started advocating for removing all these advertisements, as we all know that tobacco industry does a lot of marketing stuff, and Ganesh Chaturthi being a huge festival, being attended by so many people in Mumbai, tobacco industry used to have various kind of advertisements of their products. When we started in 2008 and 2009, we went ahead, we did sensitization of the organizers of such Ganpati pandals. At the same time, we also, our children of course, through various means went ahead in such kind of pandals and then created awareness among people. So you can see here in the slide, when in 2008 and 9, when we started, there were around 457 advertisements. There is a typo, it's not shop. Sorry, so this one is a shop, of course. There were so many advertisements at the marquees, but right now, today, on the date, there are no tobacco advertisements that you can see in any of Ganpati pandals during Ganesh Chaturthi. We have also sensitized the organizers, and in fact, organizers in their own GRs have now included that during Ganpati pandal, they can take sponsorship from any company but tobacco industry. So it has completely stopped. Similarly, you can see that our children had gone to those tobacco vendors who have shops selling tobacco products in and around their schools. When the students started, we have also been doing this study year on year. And then in 2008, when we did this study for the first time, there were around 457 shops, around 350 schools. Now today, we have lesser than that. I will not say that it has completely vanished, but then definitely the number has come down. As a result of sensitization that our children have done with the best people, here you can see earlier when they were ads, it was, the entire panel were filled with Sanjay Dutt's ad of Goa, Gutka, Pan Masala. Now you can see no tobacco best policy, tobacco free bus, best buses. So the panels have definitely changed. And this surrogate advertisements on the bus fleet number is around 4,618. Okay, you can imagine when these buses fly. So this advertisements is being viewed by how many people? Salam Bombay Foundation has also been very successful, and it was not so easy. It was a long, I think, road for us. It took maybe around 4 to 5 years to convince Education Department, SCRT in Maharashtra government to include tobacco control lessons into school curriculum. And since 2015, in the books of and it can be of any subject, science, environmental, or a physical education book, somewhere also in the English language. So in the grades of 5th, 7th, 8th, 9th, and 10th, we have been able to integrate certain chapters where we talk about ill effects of tobacco and how these children can be very helpful in curbing that. Now, this is the impact of our program. The study was conducted on our program in the year around 2010-11 by Harvard. They had come down here in Mumbai. And this is not what we are saying. This is the result of the study they had conducted on our program, where the study clearly states that the student in Salam Bombay Foundation intervention program are half as likely to report tobacco use in comparison to other schools or other students who are not in our program. As well as the awareness level of our students is also far more higher in comparison to other students. And definitely, as Dr. Swasti had explained in his presentation, there is a COTPA law. There is a tobacco control law which is called COTPA. And the section 5 and 6 has been very, very helpful to us in keeping our youth away from tobacco use. The section 5, which talks about prohibition of direct and indirect advertisement, and section 6 A and B, which talks about prohibition of sale of tobacco to the minors and prohibition of sale of tobacco within 100 yards of any educational institute. Tobacco control law, which is codified in India, is very, very comprehensive. But having said that, we, as a civil society who have been implementing this program at a grassroots level, have also faced a lot of challenges in implementing this particular law effectively and efficiently. So now I will talk about the challenges that we face, and these are very specific to section 5 and 6, as I was asked by Pragati to explain it as a civil society. So as per our experience, the challenges that we face while implementing section 5 and 6 is lack of awareness. Now, when I say lack of awareness, it is not a lack of awareness of ill effects of tobacco that I'm talking about. I'm talking about section 6.5 and section 6b. In totality, I can also say that it is the lack of awareness of COTPA. So we talk about policy to action. Policy, of course, has been created. And then our policy makers are very proactive, and they have put a lot of hard work into it. They have created those policies, but it has to be brought into action. So those people who are supposed to bring these policies into action, those enforcers who are supposed to implement it, our field experience has been that they are unaware of such kind of existence of law. The police people, when our students go and then sensitize them, police people are not aware of tobacco control law which exists. They are unaware of the sections of COTPA. Number 2, when we talk about policy to action, when we say to, so where? So in between there is a gap from policy to action. Fine, policy is made by policymaker and action is supposed to be done by the enforcers. Now in between there are people, there are two kinds of people. One is the beneficiaries and second who are supposed to follow that law. The beneficiaries mean maybe parents, teachers, correct, general public, but they are not aware about COTPA or they are not aware about section 6 or section 5. So if they are not aware that there is certain law which can help them or which can help their children getting exposed to such kind of advertisements, where are they going to complain? Second, tobacco vendors. I'm just giving you an example. So to take an example, I'm taking example of a tobacco vendor. Definitely, there is a law which says, section 6 says that you cannot sell tobacco products within 100 yards of the school. But does a tobacco vendor know that? No, he's not aware of it. So that's a lack of awareness, and I think it is one of the biggest gaps where we really need to work. Policies exist, but does the beneficiary and the people who really need to enforce it, they know it? So this is something that we really need to work on. The second point is lack of interdepartment coordination. And I'm talking from the point of view of the experiences that we had while implementing these laws at the ground level. So for example, we work with schools, correct? And there is a law, section 6A and B, where around 100 yards you are not allowed to sell tobacco products. Fine, education department knows it. So when we go to the school, we say, sir, there is a shop just outside your school. So education department, the principal first of all says, I am not aware of it. I don't know what to do. I cannot take any action. So an education department as a whole doesn't want to take any kind of responsibility. When we go to the home department, definitely they are supposed to take actions. They have limited people, but at the same time, they do not know where to get the reports from. Either we'll have to prepare the report and give it to the police department, and they will go and take the action. Similarly, in Maharashtra, especially when we talk about tobacco control, there is FDA and there is health department, and both the departments there is a huge gap. There is no internal coordination. So, for example, National Tobacco Control Program is headed by health department, but there are a lot of information where the NTCP head, nodal head of the state needs to get information from FDA department, but that doesn't come to her. And that's a big problem. There is no interdepartmental coordination, which again creates a big problem for us, for the civil society like us, who have to implement this program at the grassroots level. The third issue that we face, especially the challenge that we face, especially in regards to Section 5 and Section 6, is the penalty amount, which is not at all significant. So, for example, if somebody violates Section 6A and B, the penalty amount is rupees 200, which is very, very petty. It doesn't matter to tobacco vendor, correct? So tobacco vendor pays 200 rupees. For 2 days, he doesn't open his shop, but on the third day, he again opens his shop. So in our opinion, this penalty amount really needs to be increased to a significant level. What we did in Maharashtra is we did this kind of advocacy with our local government, with our local corporation, and then have included this particular law of COTPA into Municipal Corporation Shop and License Act. And what we have done is we have increased the penalty over there, more than increase in the penalty amount. What we have included is that if anybody violates this law, their license is going to be revoked. So this is something which is working for us, because license getting revoked is a big thing for tobacco vendor rather than paying rupees 200. Second very important thing about penalty is, for example, here it is written, it is up to 200 rupees. It is not 200 rupees. It is up to 200 rupees. So it also in reality, so it's a nexus between the enforcers and the tobacco vendors. He may pay 50 rupees, he may pay 80 rupees, he may pay 100 rupees. So that again really makes it very difficult for us. The fourth point that we have is this law needs a lot of clarity. So I'm not talking about the policies and the sections, but as soon as we come to implementation and the onus of the implementation of the same law, there is not much of a clarity. To give you one example is, for example, in the section 6A and B, it is said that there has to be a board outside of the school where it should be written on the board that around 100 yards, this particular, in the area of 100 yards of the school, if this is not followed, then there will be if there will be a violation of the law, then you are supposed to pay this much, that much, blah, blah, kind of stuff, all the details. But when we go to the school, because we work on a day-to-day basis with the schools, when we go to the schools, principals are not ready to take the onus. Anywhere in the COTPA rules and regulations, nowhere it is mentioned that to create that board where the money is going to come. Municipal schools, especially where we are working, are struggling with their day-to-day expenses already. Government doesn't give them enough. So they do not want to take money out of their school kitty and then print this board and then hang it outside the school boundary. This is just one simple example that I would like to share. There is other issues also. So for example, even with the police people, they are not clear on that fine. Where is the challan? Who will print the challan? Who will give us the challan? Where, when we will raise any challan, where is the money going to be? So these are certain gaps which is there, and therefore they also are little reluctant to take action because they don't want to get involved in all this kind of unclear, messy things. This is something that we have experienced as a challenge. This is it for me to say right now. Over to you, Pragati. Thank you.
Thank you. Thanks a lot, Dr. Sherry, for talking about the experiences of Salam Bombay Foundation, as well as helping us understand the challenges in implementing many of these well-conceived laws and regulations. We now move on to a brief question and answer session, and I hope we can cover all of the questions that are coming in. Let me begin with Dr. Swasti. So Dr. Swasti, I'll try and combine a few questions so that you get a bit more to speak, time to speak about the implementation challenges. So there are questions around which kind of policies, programs are very effective for youth but are less explored. Programs or a policy that are already available, which are known to be probably very effective among youth, but are not very much well explored. And in line with that, there's a very interesting question on how the 100-yard rule was arrived at. Any idea on why 100 yards and how that came? So maybe both of these, if you could reflect on.
Okay, Prasanna, I think for the 100 yards, I'm no privy to the discussions happened that time in 2003. Why 100 yards and why not 100 meters? Even like 100 meters will be shorter. So I really don't know what was that, what was the background. But I think it must have come out from discussion with the guidelines being framed during those days in the FCTC articles as well. So that institutional memory, I still I don't have that. I think for the policy which works for the youths, now I think all the policy, it works for all of us, including the youths. Now, so now it is the implementation of that component, that the program component, which is guided by the policy, which is being implemented differentially by the different states. And so, say for example, the 100 yards in many states, I know that you also are aware of the yellow line campaign, or some people have got the blue line campaign, and they do it, and then many of them are implementing it properly. So within this yellow line, this is 100 yards and you will not sell the tobacco products, and many people follow that. But in some states, even if you have a yellow line, just outside the yellow line, if you sell the tobacco product, then legally you cannot do anything. So many states may be having that problem. Then to solve this problem, some of the states, how do they come? I'm just trying to give you an example why we have got differential implementation. Say in some states, they have got what is known as, all the states should have the district level coordination committee. Okay, and that is led by the authority of the district, who is the district collector, or the SDM we call it, and the district under him, the district nodal officer of the tobacco control program is the member secretary, and he has a meeting of all the members, and that consists from education, that consists the members from the home, which is the police department, and other departments, including the representative of the public as well. Okay, so now in that meeting, so I'm trying to answer some of those queries as well regarding the effective implementation of the that particular section of 100 consisting of 100 years. So some states, what they do is they ask the education department to list out. They have an order from the education department asking all the school teacher to list out the vendors around their school. They just have to list out. They will say that I have got 5 around my school. That's all. The teacher will not go beyond that. And then the education department compiles this and then give it to through the DLCC to the chair of the DLCC, and the chair says, okay, look, we have got this many schools reporting this, and give it to the police. And for police, taking care of those schools which have those vendors which have been already identified by the education department, it's very easy. So that way they have taken care of that. So this has been successful in some states. These are not yet successful in many of the states. So these are differential. I do not say that these are very effective and these are not effective, but it is up to the states which makes them effective or less effective.
Thank you. Thanks a lot for reflecting on the effectiveness among youth of these policies. And I think a few other questions that came in also you answered, because there were a lot of questions on how can education department stakeholders be better empowered to act on some of these provisions. And I think if I understand your answer correctly, it's also about sharing lessons between states and ensuring that good practices of one state or district are transmitting well to other states and districts so that they can borrow these strategies and implement them. Coming to you, Dr. Sharing, what are your thoughts on? So you've already mentioned some challenges that you're seeing on the implementation side. Do you have any thoughts on what kind of approaches might help either district or state level implementers or NGOs or research organizations to help overcome these challenges? What would work best in your opinion?
Ashik Prasad, through the experiences that we had, I would like to say two things. One, I think the union government has really done a great job. We do have policies in place. The only gap is when it comes to the implementation from policy, from the time that it comes from policy to action, there is a gap. And that gap, I feel, is about awareness. It's not about the awareness of cause, but it's about the awareness of the policy. And that is where I think we really need to work on. To give you an example, when there are certain kind of questions which comes to any of the police station, do you know that paper comes to Salam Bombay Foundation? Because they have no idea about Kotpa. So we have filled in that form so many times and sent it back to police station so that they can send it ahead. So I think those are the things. But at the same time, having said that, I also understand there is a lot of constraint on the government also. There are very limited people, and each and everyone cannot implement that rules and laws when it comes at the grassroots level. And this is where NGOs or civil societies like Salam Bombay Foundation really plays an instrumental role. We are there to help government. That is one. The second thing you said was as a research organization, uh, uh, not to offend anybody, but let me tell you, so the NGOs like us who are very much into action, they will always believe in action. Okay, so they are very busy getting it to the field. But at the same time, research organization, what they do is they do their studies, correct? But then I think there is also a gap. So that particular study or the result which has come has to be treated as an evidence, and then that also needs to be translated into action, correct? But where does that go? Where does that go? It doesn't come. It comes on the paper, it comes in the journal, and then it goes on the shelf. That should not happen.
Nice. Thank you. Thank you, Dr. Sharing. So I think that's an important message, especially for those in the audience who are from the research community, to probably consider more research approaches that are implementation friendly, that are policymaker oriented, which involve working together with implementers and policymakers. And I think that's a very important point that you make. The next question, I leave it to either of you, but there are a couple of questions around vulnerable children or children from vulnerable communities, or young people who probably need a different way of help than what is offered in the mainstream programs and policies. Do you one person is asking about, is there a very big difference, for example, between type of children by socioeconomic, caste, gender kind of stratifiers in terms of their use? And someone else is asking, for example, about how can we better implement tobacco control policies among most vulnerable communities in low income neighborhoods, or in tribal communities maybe, or in remote rural communities? Would you have any thoughts or ideas or reflections on this? Dr. Swasti, I see you nodding. Would you like to go first?
Yeah, I can go first here. As rightly said, that how our program would work for the children is also how we are able to approach that target population. Through the school program, through the IEC that we roll out, or through other various means. Now, if we are having a lot of school program, but if the children doesn't come to the school, then they have no access to it. So that kind of challenges happen in some parts of the country. So we need to get on to that. So we have got other programs which comes to the grassroots. Like for example, we have got other programs like the immunization, or we have got other programs for Anganwadi centers, or other NCD program. We even have the population-based screening. So a health worker is going to come to your to the doorstep for your screening for the NCD clinic. So that time, if you harness that opportunity, that if you go to the slum areas, when you do the PBS, then if you see children using tobacco, if you know that the father is using tobacco, then that time linking linking him with the quit line, or linking the children with the quit line, or to the IEC material. That is all what we can hope. But these are real challenges in real world, and many of the NGOs, the civil society who are working can fill this gap. So I think the state government will have this challenge, although this gap is reducing now. This many children are coming to school, and the gap is reducing, but that gap we need to fill that together along with civil society.
Dr. Shering, would you like to also address
Yeah.
this question?
Yes. As
Please
Dr.
go ahead.
Swasti correctly said, of course, when we go to the rural areas of India, definitely to reach out to these children, self-help groups, health workers, they are really, really helpful. But at the same time, the teachers who are in the schools, so they are also very, very important. The message that you want to send to this young generation, if it goes through teacher, it really makes a difference. And I think those teachers can be one of a very instrumental element in passing on the messages about tobacco control, creating awareness among them. Remember, in India, teacher is the only one person who is looked upon as an idol. Everybody looks up to them, and especially if we go to the rural part of India. So I think that really works. That is what Salam Baba Foundation is also doing. At the same time, we are also identifying those NGOs who may be working in some other health issues, but then it can also be integrated in their day-to-day work because it becomes important. For example, take COVID-19. So there are health workers who are going and then maybe talking about COVID-19 and taking precautions to stay away from COVID-19. At the same time, they are also integrating information about tobacco. That is what is happening in our case. So it is really, really helpful. And as far as urban setups are concerned, I think creating peer leaders are very, very important. You and I going and then reaching out to those adults and then saying, oh, don't do this and don't do that, doesn't work. But then, yes, of course, their own friends, their own peers who have been through this and have come out, if they become a peer leader and reach to them, it really works. And I think especially the underprivileged children, to them, if you reach through schools, that is, I think, best way and the best place to reach to them, because most of the things that they do is at the school. Most of things that they learn is at the school. This is something which they do not get to learn at their home. They do not have that kind of a well-educated parents who can guide them. Whatever they learn is through their peers and the teachers in the school. So it is very, very important. There are certain policies which I feel has to be made mandatory. So for example, tobacco-free school. So we have a guideline for the tobacco-free school, but remember, tobacco-free, every school should have a tobacco-free policy. Such kind of policy has not been made mandatory by any of the government institute.
One more. Thank you, Dr. Shering. And I see that the role of civil society in bridging some of these atypical scenarios into the policies and programs is being made, and also some of the strategies you suggested. We have only 4 more minutes. I know Dr. Swasti especially is sitting in Delhi, and he must have a lot of things to get back to. So I invite quick comments on 2 sort of philosophical sort of points that have been made in the chat. One has to do with what about non-punishment ways of creating behavior change? Has COTPA or the government been considering sort of health promotion kind of ways as opposed to the punishment-based ways, which I will address to Dr. Swasti. And later, perhaps another follow-up in case either of you wants to take on is how do we sensitize government departments on also other government departments, because health is very much aware of tobacco. Other government departments, how do we sensitize them to, like finance and others, to pull back from investments and entanglements with the tobacco industry? Final remarks from both of you.
Okay, Prashant, it's like this. So the punishment, it works for some of us, and I know that we also need to do the non-punishment measures. So I have seen many of the civil society, civil society working with children, and the children goes out and gives out a rose to the, pan vendor, saying that, uncle, please don't sell this tobacco, it's going to kill us. Those are some kind of activities we do. But in India, what usually happens is like, I like Dr. Rana's example, that everybody coming coming down from Shimla or Haryana or Delhi, when they reach Chandigarh, they just start putting their seatbelt. It is not that suddenly they get aware that, it's going to kill them if you don't wear the seatbelt. It's the Chandigarh police who is standing there. They know that if they catch you, they will not leave you and they will challan you heavily. So that kind of enforcement is now required in India. So we need to have more and more enforcement, but we also need to breach in with those non-punishing kind of measures that we have. So going from there to the other part, how do we engage with other people? So I know some organizations like Samban, led by Sanjay Said. So he goes to the police training centers, or he goes to the some of the institutes where when they have the regular training of police department or education department. Then they ask them, okay, this is if you explain to them tobacco is like this, it doesn't work, because they see that it's a different department job, and we don't need to do anything. Like, for example, in government sector, sometimes you need an order for the right hand to be issued by the for the right hand only. So you don't expect that the left hand will work for the with the right hand's orders, and you want something for the left hand, you need an order for the left hand. So similarly, education will always look for education department's order, and health will always look for health department. So bridging this was our challenge. So what we do from the center, we sent out letter from the health ministry to the education, then requesting them to send a letter. Then they sent out a letter, then it is an education department's letter. Then it goes there, but then we go to the state headquarters and then talk to the STCC and then tell them, this is a letter from education, this is the letter from health. Now, how do you bridge them? Then police, as we all know, that they have got so many things to do in their hand, and tobacco is the least of their priority, because they have got rape and murder and so many things to do. But I know that some organizations, they succeeded with the police, getting involved. How they do is, they go and explain. They go and just show a film for about, say, 3 minutes or so. Then they show the different pictures of cancer patients in Tata Memorial, for example. Then after that, we ask them a question. Okay, so do you want to do anything? Do you have anybody in your family who suffer from tobacco or tobacco related cancer? Then thanks to tobacco, it caused many cancer, right? So many people will raise their hand. Yes, I have some uncle who died of this. I have my cousin brother or cousin, my uncle who died of this. My own father died of cancer related, tobacco related cancer, and so on like that. So then we link to them. Okay, do you want to do anything? Then we ask them, do you want to do anything? You can do anything. The doctors are trying to save, but as a policeman, you can save thousands and thousands of people. Doctor will save only 100. So we make them a hero. Then they say that, what do we do? Then this is Kotpa. This is the actions to that. Then Chalan, the police have been doing throughout their life. Oh, chalani karna, then they will start doing the chalan. So I know that many of the districts, many of the states. And then how do we monitor them? That DLCC that I already explained to you, in the district level committee, if the DC or the SDM decides that every month the police will have to come and tell us how many Kotpa violations they have recorded. So then, to make it institutionalized, what they do is they have a form called monthly crime review report. So there they have got how many tapes and how many there in the last column they have already added Kotpa. Okay, Kotpa violations. So now if I don't do anything this week, or or for 1 month, if I don't do anything, I have to put 0 there. So no, SHO or no the district SP will like that figure 0. So they will start acting. That's the easiest for them to do. So whenever they go for some other work, they will do the chalaning, and then that particular action will be taken care of. So this is one example. We can go on, but time is limited, so I'll give the rest to sharing again.
Sharing any last remarks? We are already at 4.
Thank you, Dr. Swasti. And then Prashant, there is no one answer to it. Again, Dr. Swasti also said, and it needs to be turned and tweaked as it penetrates. So from top to bottom, it has to be turned and tweaked as per the requirement, whether it is an individual's nature or their interest or understanding, or whether it is law. It has to be. Salam Bombay Foundation works in so many states, correct? Our own program we have turned and tweaked as per their requirement of the state, the nature of the state, the nature of people's understanding. We have changed it, correct? So it cannot be one answer. As far as individuals, especially youth and young children are concerned, of course, I'm not going to talk about government and how it can be handled and what are the possibilities that Dr. Swasti has already explained. So let me talk about young, adolescent, or youth people. So for them, as when we talk about tobacco victims, it is same with youth also. When you go and talk to them, and then it works, though danda and mithai, both kind of thing works for different group of people. So for some, of course, it will be sweet talks, it will be nice talks, it will really work. For few, until unless you give them danda, it doesn't work. So let me give you a very small example. When we talk about tobacco, correct? So mostly it is associated with cancer. So when you go and then talk to these young boys and say, it will cause you cancer. So the answer is, jab hoga tab dekha jayega, bahut time lagega. Correct? But now when we are associating tobacco use with COVID-19, see the impact. It's immediate. Because right now what is happening is COVID-19 is not going to wait for, like 19 years or 20 years down the line when they become old, correct? It is happening immediately. So this is something which is working for us. So it depends. It depends. So as I said, there cannot be one rule for everybody. We will have to see, we gauge, and then that is how we take our another step.
Thank you. I guess that's an interesting last remark, that one size does not fit all. And I think everyone in the implementation research world will immediately agree with that we need more adaptable and more flexible programs that take into account the differences in our population as well. So on that note, although I see several questions, to just tell you the themes, there are questions around what kind of research questions would you suggest for us, questions around what kind of standardized peer engagement strategies are known to work, use of Juvenile Justice Act, questions around some of the provisions which are not well implemented, such as loose cigarette sale and empowering education departments. So there's a lot, and we can have an entire workshop merely on this, I guess. But unfortunately, that's not what we all signed up for. On that note, I thank both the speakers. You both made time from a busy schedule and really spent time interacting with all of us. And I hand over to Pragati for closing the session.
Yeah, thanks a lot, Prashant. Thanks, Dr. Swasti and Sharing for the excellent presentation and insights, and an attempt to answer these questions related to implementation, which is the focus of this webinar series, as well as the project at hand. So, and thanks to each and every one of the participants for staying in, for engaging so much with our speakers, and for any further information related to the work of Anushtana project or IPH in general, as we have been in the field of tobacco control for the past decade or so, worked with implementation, worked with themes related to tobacco industry interference, which is the theme of the World No Tobacco Day. Please do visit our website, and we would since this is a webinar series specifically on implementation, we will be taking many more sessions in the future and answering and trying to answer these questions of what works where, why, and how. So thanks one and all, and we would end it here today. Thanks a lot.
Thank you.
Thank you.